All right, good afternoon, everyone. How are we today? Can we give us some noise for this trailer? This is so exciting to have this kind of showing. We want to just say good afternoon. My name is Ashley Comans. I wear many hats. I am a strategist, an organizer, an executive, but one of the things that I am clearly most proud of is I am a mom. So, yeah, shout out to the moms. In my capacity as board chair of Catapult Greater Pittsburgh, our focus is on pulling people out of poverty and working towards economic justice. That means helping put our neighbors from across the city and this county on a path to leading stable, prosperous lives. From the outset, that means healthy starts for working families. At Catapult, we make it a priority to take care of one another. It is our firm belief that a staff that has their needs met and can show up as their fullest selves make for a thriving workforce. This includes providing fully paid parental leave as a core tenet of our employees' well-being. Like many of the people in this room, my life's work is fighting for solutions for our communities. But as it stands, too many parents are being forced back to work, babies and new parents pulled away from each other during critical bonding times in their lives. And families across Allegheny County are being pushed to the brink by the financial strain of missing extended time from work. As a collective, the Parental Leave to Help Families Thrive Coalition believes paid parental leave fits squarely in this mission. Paid parental leave reduces financial burden on new parents, allowing them to adjust to life with a new child without the worry of where their family's next meal will come from or how their latest utility bill will be paid, or worse, feeling forced to return to work before physically ready, endangering the health of mom and baby. Paid parental leave addresses the maternal mortality rate in our area, which has skyrocketed in recent years. And we have a responsibility to protect the health and futures of families in our communities. Paid parental leave makes sense as policy, but most importantly, as a life-saving measure for mothers and infants across Allegheny County. So today we thank you for being with us this afternoon as I stand alongside the bloodline of our hospitals, which is our nurses, workers, allies, and fellow moms, dads, all across the county to call for paid parental leave for all working families. So, to kick things off, I would like to introduce Marshall Robinson, nurse at UPMC Women's Hospital. Hello, my name is Marshall Robinson. I'm a mother of three and have worked in the healthcare field for almost 2 decades. Those experiences have shown me firsthand why paid parental leave is essential for the health and well-being of parents and babies. I currently work as a registered nurse on a high-risk postpartum unit at Magee, where we care for the sickest and most medically complex mothers in the tri-state area. In this role, I care for mothers with a wide range of high-risk conditions, such as preeclampsia, diabetes, kidney disease, and heart conditions. We also care for their vulnerable newborns. These mothers don't have the option to simply bounce back. They remain hospitalized for extended periods of time while they heal physically and mentally. But while they're fighting to recover, bills continue to pile up. I've heard firsthand from my patients who are overwhelmed with stress, worried about losing their jobs and their homes. We all know what the rising costs of housing, groceries, childcare, and everyday necessities is becoming a little harder for working families, especially more so to survive on one income. Too many mothers are forced to return back to work. Too many new mothers are forced to return to work before their bodies are ready. As a result, we see mothers admitted during the postpartum period with serious, often preventable complications. I have a deep empathy for my patients because I've also faced some of these challenges. I had my first child at 19 while working full time and being was often sick during my pregnancy, requiring time off, and experienced birth trauma during delivery. Like many of the mothers I now take care of, I didn't have the time I needed to recover, and I ultimately lost my job, all while dealing with severe postpartum depression. But I've also experienced what support looks like. With my second child, I had access to a stronger parental leave policy, including partial income. That made all the difference. I was able to recover without the same financial stress or pressure to return to work too soon, all while being able to bond with my babies. The contract showed me how critical paid leave truly is. It's not just about time off, it's about health, stability, and better outcomes for both mothers and babies. Unfortunately, at Magee, nurses only receive 2 weeks of paid parental leave. And I've witnessed how that hurts the well-being and retention of my coworkers. I'm here to be a voice for the mothers I care for every day, and for the nursing profession. The Board of Health's proposed parental leave policy would ease the financial strain during recovery and give all working families the time they truly need to heal. But most importantly, parental leave is essential for addressing the infant and maternal health crisis and making sure all working families can thrive. No mother should have to choose between her recovery and her livelihood, and no baby should have to suffer because of her. Thank you.
Thank you so much, Marshall. Next, please join me in welcoming Stephanie Fellow, grocery store worker and executive board member of UFCW 1776.
Good evening. My name is Stephanie Fellow. I live in Plum, and I'm a proud executive board member of our state's largest grocery store union, UFCW 1776 KS. I wanted to share my struggles with becoming a mom to illustrate why I'm a strong supporter of paid parental leave. When I had my son 8 years ago, I didn't have any paid parental leave from my employer at all. I tried to sign up for short-term disability, but there was an issue with the paperwork, and I ended up not getting it. The insurance agent felt so bad that he raised $800 from his church to support me. I took the full 12 weeks of unpaid leave under the Federal Family Medical Leave Act, and had to rely on friends and families for meals. Working parents should not have to rely solely on our social networks to support us. We should also be supported by our employers. I'm sure I speak for most parents when I say becoming a mom has been the most rewarding and the most difficult experience of my entire life. I've had so many physical, financial, and mental health challenges. When you have a healthy baby, your life is turned completely upside down. Keeping that baby fed and healthy becomes your only priority. I was committed to breastfeeding, but it took a lot of trial and error to do it successfully. When I had to return to my job, I needed to pump at work. I had to keep the pump carts clean and sanitized. I had to remember to bring them with me to work. That, in and of itself, is very time-consuming, let alone keeping your house clean and paying your bills, and getting to work on time. On top of the difficulties caring for my baby, I developed gallstones and had to have my gallbladder removed. I also struggled with postpartum depression. Bringing new life into this world and making sure that life can thrive is a very, very tough job. We need to support the moms and the dads of our county as much as possible on that journey. As working families are struggling more than ever with the rising cost of living, this is a matter of not only health justice, but also economic justice. Thank you.
Thank you, Stephanie. Next, I'd like to introduce Ebony Flowers of New Voices for Reproductive Justice.
justice, I am here today in support of paid parental leave because this policy is fundamentally about the dignity and the ability of families to thrive. At New Voices, we center Black women, Black families, and when we talk about paid parental leave, we must be honest about who is most harmed when these protections do not exist. Far too many families are forced to return to work before they are physically, emotionally, or financially ready. For Black women in particular, this burden exists alongside long-standing disparities in maternal health outcomes, higher rates of pregnancy-related complications, and persistent economic inequalities. The reproductive justice framework teaches us that people should have the right to have children, not have children, and raise children they have in safe and sustainable communities. That last principle matters here because the ability to raise a child with dignity does not begin months after birth, it begins immediately. I'm gonna say that again, it begins immediately. It begins with having time to recover from childbirth. It begins with having time to bond with the new baby. It begins with being able to attend medical appointments, establish feeding routines, and support the health and well-being of both parent and child. Paid parental leave is one of the policies that makes these things possible. Research consistently shows that paid leave improves health outcomes for parents and infants, supports family stability, and helps workers remain attached to the workforce over long term. This is not simply a benefit for individual employees, it is an investment in healthier families, healthier workplaces, and healthier communities. As Allegheny County considers this proposal, I encourage you to view paid parental leave not as an expense, but as an opportunity to demonstrate what it looks like when policy aligns with our values. Every family deserves the chance to welcome a child without immediately facing financial hardship or impossible choices. I urge your support for paid parental leave today.
Thank you so much, Ebony. Next, please welcome Magee nurse and soon-to-be girl mom, Lucy Rose Ruscio.
Hi everyone, my name is Lucy Rose Ruscio, and like she said, I'm a neonatal nurse practitioner at Magee Women's Hospital, and I'm here to speak about parental leave. I'm here as an advocate for my patients, my profession, and also for my 2 young sons and myself as we look forward to welcoming our third this fall. I think what unites us today is a unique combination of love for our community and rage at the growing crises we have at hand. Love and rage is a combination that mothers know too well. A combination that I've witnessed for years as a bedside NICU nurse, watching parents struggle to balance the joy of childbirth, the anguish of a NICU admission, and the dread of the timeline to go back to work. In Magee's NICU, we care for babies who are born as early as 5 months, often weighing less than 1 pound. They can stay in the hospital for 6 months or more, and before they're safe or ready to go home. Their parents want to be there with their newborns as much as possible, and they should be able to. Not only is a parent's presence important during a NICU stay, but also when the newborns are discharged from the NICU, they often have specific medical needs and dozens of follow-up appointments. I see firsthand the intense pressure on parents as they try to balance the demands of caring for their fragile newborns while trying not to lose their paychecks or even their jobs. This pressure negatively impacts the health of both children and parents, and we see it show up in the data around health outcomes for Allegheny's infant and maternal moms. I also experience this pressure on my coworkers and myself at Magee. We talk a lot about who can't afford this bill. Let's talk a little bit about who can. UPMC is the largest private employer in our county and our Commonwealth. 67% of all hospital staff in our Allegheny County, that's 60,000 workers, are employed by UPMC. And thankfully, UPMC seems to be doing just fine. They just reported $261 million in profits for the first quarter of this year alone. Magee is the preeminent women's health institution in our region, and I'm so proud to work there. We have a majority women workforce, and despite all of this, UPMC offers just 2 weeks of fully paid parental leave. Let me say that again. UPMC offers just 2 weeks of paid parental leave to people who have dedicated their lives to taking care of infants. I see how the lack of parental leave pushes nurses away from the bedside, worsening a nursing shortage crisis that is already worse in Pennsylvania than any other state in our country. Right. Nurses, even though whose lives are dedicated to the care of infants, they can't take proper care of their own babies when they get home. Earlier this year, we launched a community survey to hear directly from the people we serve, and that was in order to inform our ongoing contract negotiations. Over 1,000 Allegheny residents responded, and there were 2 clear needs that shone through. Our patients want more time with us nurses at the bedside when they're in the hospital, and when they get home, they want more time off to care for their newborns. 85% explicitly said so. Employers like UPMC have the resources and the moral responsibility to do more. But they will only do so if they are held accountable by our community and our government leaders. That's why I'm urging the Board of Health to pass paid parental leave for the health of all working families. Thank you.
Thank you so much, Lucy Rose. And last but certainly not least, I'd like to introduce Elise Pinchak, co-founder and executive director of Black Women for Better Education.
My name is Dr. Elise Pinchak. I am the executive director of Black Women for Better Education and a mother. I am honored to stand alongside this coalition of advocates, Magee Union nurses, community members, and elected leaders in support of the call for paid parental leave for all Allegheny County residents. The mission of Black Women for a Better Education is to ensure that Black children in this region receive the high-quality education they need and deserve. We understand that the education of our children begins long before they enter a classroom, and strong partnerships with parents and caregivers play an integral role in student success. Policies like paid parental leave directly contribute to improved physical and mental health outcomes for new parents and children by providing a strong foundation at birth upon which our educational systems can build. This is particularly important for Black families, as Black mothers suffer from severe maternal morbidity at more than twice the rate of white women. Additionally, Allegheny County's infant mortality rate is worse than the state average, and Black infants are more than twice as likely to die than white infants. In a region where academic outcomes for Black students have been perennially poor, and where racial, economic, and health disparities are some of the worst in the nation, it will take the collective efforts of all of our systems to improve the quality of life for Black families. Paid parental leave is an important step in addressing the health and economic security of working families in Allegheny County while laying the groundwork to improve educational outcomes. Let's put our families first and pass this policy.
All right, thank you so much, Dr. Elise Pinchak. I definitely want to add that doctor on there. And I also want to just thank each and every single one of our speakers for sharing their stories and being vulnerable today, because I think that storytelling is what we need to share more of for folks to really understand how important this is for our community. So in what is already a whirlwind period of adjustment, the last thing that any family should be faced with is the stress and uncertainty of spending extended, unpaid time away from work to care for their new baby. Or worse yet, new parents feeling forced to return to work before they're fully healed, simply for their family's survival. Working families across Allegheny County deserve healthy starts that mean ensuring that new parents are afforded paid parental leave. At a time when federal cuts to our health care and social safety net are stretching working class people further each month, Allegheny County has an opportunity to be a model of what is possible when we put families first. So again, we are here today as moms, dads, nurses, workers, neighbors, standing together for the health of all families across Allegheny County. We know what a lack of paid parental leave has meant and continues to mean for working families. And we also know paid parental leave is good policy. But even more importantly, we know paid parental leave saves lives. So thank you so much to everyone standing with us, the working families and allies of Allegheny County who are working alongside us to fight for real solutions to the Black maternal health crisis, the nursing crisis, and affordability crisis for families welcoming babies into their lives. Allegheny County needed paid parental leave yesterday. But there's no better time than now to make it a reality for all families. Thank you all so much for being here.